fact is, you can't fight a pandemic without reliable data, and it has to be as close to real time and as reliable as you can get it in the face of an emergency. We in the United States were terrible. We were relying on Israel, Britain, Singapore, and other countries for data. Data on variants, data on vaccine effectiveness, data on hospitalizations, how severe any vaccine was. We had terrible, terrible data problems in the United States. The main reason we had terrible data problems has to do with our laws. The United States does not, the federal government, the government in Washington, cannot say to every hospital, you need to give us data. It tells the states then tell, and the states don't have to give it to us. So they can stop sending it to us being the federal government, not me. It's a terrible system. Tried to change that system, but no country will change it. The crazy thing to me is all those states, the money that the federal government gives them to run their public health data collection system, all federal money. A good politician would have said, we're giving you money, we want your data. You don't give us data, we don't give you money. That doesn't, it's not no genius needed for that. We need to create those kind of incentives. By the way, this, in the United States at least, this isn't just a problem of COVID, it's a problem across the healthcare system.